Hi, I'm Morse from Core Elements Training. In this short video, we're going to go through a self-cupping to the lower leg, focusing on anterior tibialis, gastrocnemeus and soleus, and releasing that tension in the lower leg area. So if you've got a treatment couch, you can do this on your couch. Alternatively, 2 chairs will suffice because you want to make sure that the muscle that you're focusing on and cupping is nice and relaxed. Okay, so you will need your cups from your cupping kit. This is the hand sole kit, and you can get a 10-piece kit from Physique, which is ideal for self-cupping. You'll also need some medium. So here I'm using the Lotion from Physique, but you can use oil or wax as well. Whichever medium you've normally got freely available at home will be absolutely fine. Within your kit, you'll need a selection of different sized cups and your pump as well. So you're going to put your lotion onto the area that we're going to cup. Okay, so using a little bit more lotion than you would do normally and covering all of the tissue area. Okay, so we're going to start off with static cupping, which is literally putting the cups on and leaving them. So you're going to put your cup into the bottom of the pump here. Okay, and then we're going to pop it probably about so anywhere between 1.5 to 2.5 pumps into the cup. Okay, hold the cup down as you release the pump there, and then the cup will stay on the tissue. Because at first your cups and the pump can be a little bit tight. Okay, then from there, going down the tissue area. As we get nearer to the ankle, the muscle turns into that stronger tendon, so it will get a little bit tighter. So you might want to use a slightly smaller cup as you get nearer to towards that ankle joint. Make sure as well that again you are covering the whole of the bottom of the cup with the tissue. Okay, you can focus on the front of the limb, or you can do both sides at the same time. So we're now coming into the gastrocnemeus. Okay, popping that cup in. You'll probably find, because the gastrocnemeus in this position is a little bit more relaxed, so you might get more tissue suction into the pump, but you're listening to the body, making sure that you don't feel pain. You should feel that suction lift, but it shouldn't feel painful. And as you're putting the cups on as well, you're checking the colour of the tissue inside the cups, which is one of the reasons why the cups are see-through, so we can see what's happening to the tissue. Make sure that it's not going a dark purple blackish colour. You want to stay really sort of like a pinkish reddish colour, and make sure it's not painful as well. Okay, so keep monitoring the colour within the cups the whole time. So we could stay with this static cupping for anywhere between 2 to 5 minutes, and you'll feel after a couple of minutes that the stretch reflex has kicked in and the tension within the muscles has released. Okay, alternatively, we could do a little bit of active movement here as well. Okay, by dorsiflexing and plantar flexing at that ankle joint. Start off with a small movement, so lifting the toes up towards the shin, and then relaxing that foot back down again. So we're lifting the toes and then pointing those toes back down. So dorsiflexion and plantar flexion. As you repeat those repetitions, doing a variation of soft tissue release here, as you actively move that joint, you'll feel that the joint can start to move further. Okay. If any cups come off as you're doing this action, then just re-pop them back on again. Okay, and then once you've repeated that anywhere between 3 to 6 times, you should feel the tension in the tissue release. Okay, then when you're ready, you're going to lift the valves at the top of the cups to take those cups off. Okay, and then from here, once you've taken those cups off, you're then going to flush towards the knee joint. So you're taking your hands on both sides of the limb here, and you're doing an upward flushing massage movement towards the knee joint, just to help to disperse any toxins there and to help with that blood flow. Excellent. And then once you've done one side, have a go on the other leg as well. Okay. Thank you.